So what? Our education system is failing us. I think everybody knows that. Education reform needs to happen. But what about the impact on health and health outcomes? Well, if you look at the medical literature, we've been looking at education level as a proxy for literacy, and it only goes back 25, maybe 30 years that people started looking at literacy levels and how they correlate with health outcomes. You'll hear about health disparities, the differences between different ethnic groups or age groups and that sort of thing. But we have found some things that seem to relate to low literacy. Not surprisingly, people tend to have lower health knowledge. Poor health status, as I just showed you. Higher mortality, they're more likely to die younger. An increased frequency of hospital use, and an increase in emergency department use as well. And then Cindy Brock just mentioned there's this brand new review of the literature about the impact of literacy on health and health outcomes. And I just looked at that because it just came out literally about 10 days ago. They released that. And the results are pretty mixed in terms of how literacy impacts use of preventive services, chronic health care, and interestingly, tobacco use. Kind of mixed what the impact is there. So poor health knowledge. Interesting study was published in 2006. About 400 patients were shown 5 prescription labels. They were assessed their literacy level, and they were asked to just tell the words, read the words on the label, and then they recorded how many people got them right or wrong. And so these are the percentages of people that got at least one of the 5 labels wrong, just saying the words. Not surprisingly, 63% of the low literacy group got at least one of them wrong. But what's really scary to me is the group at the bottom. 38% of the folks that supposedly had adequate literacy got at least one wrong. And then they asked people to demonstrate what they would do for these instructions. Now, you heard from the video that people have trouble with this thing twice daily, taking a medication twice daily. To get scored correctly, 2 tablets twice daily, all they had to do was put 4 pills on the table, and that was considered correct. Column on the left, the people that could say the words correctly. Low literacy group, only 71% could say it correctly. Again, the scary part, the adequate literacy group, 89% could say the words correctly. But then the demonstration, put 4 pills out there, only 35% of the people in the literacy group could put 4 pills on there, and only 80% of the folks that had adequate literacy could demonstrate that correctly. Poorer health status, a large group of folks that have diabetes were asked a whole bunch of different questions, assessed their literacy level, and one of the questions that they asked is, do you have a diagnosis of diabetic retinopathy? Now, I'd be willing to guess that a fair number of you folks have no idea what diabetic retinopathy. Anybody know what it means? A couple people do, but okay, a bunch don't. Not surprising. Retinopathy is the damage to the back of the eye that occurs as a result of having diabetes. It's like the film in the camera, although we don't have film and cameras anymore, do we? And you damage the retina, and people can't see very well. It's the #1 cause of blindness in the United States. Folks with adequate literacy, only 19% had this diagnosis. Those with inadequate literacy, 36%. Almost twice as frequently it happened. And then increased mortality. This was a large study published in 2006. 2,500 participants were enrolled between the age of 70 and 79. They were assessed their literacy level and just divided into 2 groups. Those that could read at the 8th grade level or less, and those that could read at the 9th grade level and higher. And they just followed them for 5 years to see how many of them died. If you just look at the simple percentages, the people in the low literacy group, 19.7% died. But the higher literacy group, only 10.6%. About half of the group in the higher literacy group died. And then, I'm not a statistician, I'm a family physician, but there's this statistical magic that you can do where you can look at individual factors. And so they adjusted for all the things that we know about that impact mortality. Men die younger than women. We know that. If you have multiple medical conditions, you're more likely to die. So they took all of those factors and they kind of made them equal, and they just looked at literacy and how it impacted mortality. And they came up with this thing called a hazard ratio of 1.75. Still almost twice as likely when you adjust for all the factors that we know about and just look at literacy, almost twice as likely for people to die. The only other thing that was a higher hazard ratio was people who currently smoked. All the other things that we know about that seem to impact mortality were less important had less of an impact than literacy. An increased frequency in hospitalizations. A group of folks came to the emergency room, assessed their literacy level, and then they followed them for 2 years to see how many of them were admitted to the hospital. Those in the low literacy group, 31%. Those in the adequate literacy, only 14%, less than half.